What if your customers are trying to find your business online, but instead of finding you, they find your competitors? Now, more than ever, it's time to make sure you have the right SEO to make your business stand out online. Welcome to Go Mind Your Business with Terry Bork, presented by Extreme Marketing Concepts, putting your business in front of the hungry herd of buyers who are looking for you right now. Extreme Marketing Concepts, helping you drive more traffic, dominate the market, and crush your competition. And now, here's Terry.
Hello, everybody, and welcome to another edition of Go Mind Your Business on All Your Business Radio. My name is Terry Bork, and we are just about ready to celebrate Thanksgiving. Today, I have a very special guest here with me. I am joined by Dr. James Bennett of Northdale Chiropractic. Welcome to our show, James.
Well, thank you for having me.
Oh, it's my pleasure. I'm very excited to chat with you today. I think we're going to have a lot of fun.
Oh, I'm sure we will.
Yeah. Before we get started, I want to thank our sponsors, Extreme Marketing Concepts, for bringing us our program today. If you're looking to improve your online presence, drive more traffic to your website, and overall increase your bottom line, you're going to want to give them a call at 813-863-1452 or visit them online to learn more about them at www.extrememarketingconcepts.com. I'd like to introduce our guest to you today. Again, his name is Dr. James Bennett of Northdale Chiropractic. Dr. Bennett has been a practicing chiropractor since 1973. He opened his doors in Ormond Beach on July 9th of 1973, and he stayed in Ormond Beach until 1998 as Bennett Chiropractic. On or about somewhere in 2010, Dr. Bennett came over to the Tampa Bay area and again opened his doors as a chiropractor serving the community. He is engaged to Peggy Green, who is a longtime Pasco County educator, and she's taught business and accounting. And he has three beautiful daughters, Jill, Julie, and Jennifer. Dr. Bennett went to college at the Palmer College of Chiropractic in Davenport, Iowa, where he graduated with a Doctor of Chiropractic at that time in 1973?
1970.
1970, excuse me. All right. And today we're going to talk to Dr. Bennett about chiropractic, what it is, how it can benefit you, why you don't need to be injured to benefit from chiropractic, and all sorts of other questions that we're going to trip them up with, right? If you have some chiropractic issues that you would like to have Dr. Bennett look at or talk to you about, you can reach him by calling his office at 813-252-2711. So, Dr. Bennett, again, welcome to our program today.
Thank you very much.
All right. So, Dr. Bennett, can you share with us a little bit, what is chiropractic actually?
Chiropractic is a system of health care that deals with the nerve system, which is mainly the brain, the spinal cord, and for us, the nerves that run off of the spinal cord. The spinal cord comes directly off the brain and it goes all the way down to the bottom of your spine. And off of that cord come 31 pairs of spinal nerves that come out through the holes in the vertebrae, and then they branch out and go to the body. If the vertebrae sit normally and they move normally, then they're not going to be a problem. But if they get out of place or stuck, the correct word is subluxation, but most people can't remember that. But when they get stuck, we call that a pinched nerve.
Uh-huh.
It aggravates the area. It creates inflammation, which also creates inflammation of the nerve. And then when the nerve gets inflamed, it does not function correctly. Therefore, wherever that nerve goes to, the organ or tissues that nerve goes to are not going to function correctly.
Okay, got it. So, do you only treat people who have pain?
Oh, no. The spinal cord and the brain, control the whole body. And what we do see a good amount of is people that are just sick and tired of being sick and tired. They don't necessarily have to have a backache or a neck ache to come to see us. The nerves go everywhere and they control every part of your body. So therefore, you can have problems with the internal workings of your body and not really know why. You go to doctor after doctor and you take medication after medication, test after test, and you're just not getting any better. And we all have friends or neighbors that are like this. These are the people sometimes, and oftentimes when they come see me frequently, these are the ones that have a lot of pinched nerves, but they don't have pain. They just have dysfunction in their body. And what I want to do is find the nerves that are aggravated, irritated, and inflamed and fix those so they work correctly. And then the nerve will heal and the body will heal. The body is a really fabulous self healing mechanism.
Okay, I got that. Do you only treat the spine?
Mostly we treat the spine. I do treat the extremities. We do a good amount of hips and knees.
Hmm.
Elbow tendonitis with racquetball and tennis is a big thing here. And we treat a lot of different musculoskeletal things. We don't always only do spinal manipulation. We do a great deal of physical therapy in our office. We have decompression, we have ultrasound, we have cold laser for inflammation, we have traction, and we have a whole body vibration machine that's for any kind of neuromusculoskeletal rehabilitation. Most people aren't familiar with the whole body vibrator, but it was developed by the Russians and NASA for the astronauts coming out of space. And when they go out into a weightless area like space for a long period of time, their muscles deteriorate and they end up getting ultimately some osteoporosis.
Hmm.
So, what these people at NASA and the Russian Space Academy came up with was whole body vibration that vibrates the body at a high rate of speed, which contracts and relaxes the muscles in your body and it exercises them. So, theoretically, within 10 minutes of working out on a whole body vibrator, you can get an hour's worth of aerobic material, aerobic exercise in 10 minutes.
Awesome. I love the Power Vibe. It's one of my favorite things, and I know that lots of people can use it. Folks who have a disability can use it and have great benefit from that, and folks who use it for exercise. And I use it for exercise, and it gives me lots of great endorphins, and it's a wonderful machine. It's one of my
It's a
favorites.
tremendous endorphin producer.
Hmm. Absolutely. I know that folks travel large distances to come and see you. Why is that?
Some people know of me. Apparently, my reputation may precede me.
Uh huh.
I hope that's good. But I like to think they come to me because I care, I listen, and I try to get results on them as best I can.
Hmm.
And I use every available modality that's available to me to help sick people get well.
Got it. I know that you've been the only chiropractor that I've felt comfortable in having take care of my adjustments as they've been needed, and I feel very safe and comfortable in working with you. So our listeners can know that Dr. Bennett really will take great care of you while you're there, and your staff is outstanding. I love coming in there and chatting with your staff. They're great.
Thank you.
Hmm. So, does insurance cover chiropractic?
Yes, most insurances do cover chiropractic. Everything from your general health insurance to Medicare to workers' comp and
Hmm.
also personal injury protection if you're in an auto accident.
Okay, great. Great. For those of you who are just joining us, I'm speaking with Dr. James Bennett of Northdale Chiropractic. They're there to help you with all your chiropractic needs. You can reach their office if you're in pain or you're looking to improve your overall physical condition by calling 813-252-2711, and they're happy to schedule your appointment. You can also visit Dr. Bennett online by visiting his website at www.northdalechiropractic.com. Again, James, what happens if an insurance company does not, if you don't accept the insurance of somebody else, or chiropractic is not a listed coverage on somebody's insurance policy? Can they still come and see you?
Oh, certainly. We have made it a just a rule in our office that we don't refuse treatment to anybody,
Hmm.
regardless of condition or financial ability to pay.
Got it.
If you have a need and you want the care, we will work a budget out for you that you can afford and that you can get care, get well, and make payments down the line. So
Hmm.
whatever is comfy for you and your wallet is what we will do to get you well.
Okay, perfect. When I come in to have a chiropractic visit initially, what can I expect?
you can expect me to sit with you and chat with you about your general health, and you can tell me what it is that concerns you and what brings you to my office.
Hmm.
And this is the time in there where I formulate pretty much what I think is going to be wrong with you because it comes from your own words. And that's usually your body talking and saying, hey, this is what's bothering me.
Hmm.
So we sit and we chat until I think I have a pretty good idea. And then I will put it down. Everything's computerized these days, uh, by the way, electronic medical records. And we put it in a computer, which is all personal and private, fully HIPAA compliant. And then when I'm done with that and I read it back to you and I think I've got the gist of what brings you in,
Hmm.
then I will examine you and I'll start with the top at your neck and your head. And I will put you through a range of motion and certain orthopedic neurological tests from the neck, the mid back, and low back
Got it.
to check and see if everything's working correctly.
Uh-huh.
And I bend you back and forth to see which vertebrae are moving correctly and which ones are stuck or subluxated.
Uh-huh.
And then I formulate a plan from that. I think if I can help you, then I tell you. And if I don't, I will refer you to the appropriate medical specialist that will help you.
Okay.
So, what I do frequently, and I find happening more and more these days,
Hmm.
is co managing patients with medical physicians.
Hmm.
And anybody that has a family doctor out there that they like and they love, I will be happy to take your records and send them to your family doctor and chat with your doctor about what I think is wrong with you and how he and I or she and I can work together to get you optimally well.
Okay, terrific. I know that oftentimes somebody might have to go for an X-ray. Do we always have to have an X-ray if we need to come and see you?
Not always. If it's an uncomplicated thing that it just does a minor thing, I would say probably not. However, if you have uh, extension neuritis, sciatica, pain in your arms or hands, shooting pain anywhere, you may have a disc problem. And we need to start looking at what your spine really looks like rather than giving you an educated guess.
Hmm.
So we start with a basic set of x-rays, which I don't do in my office, by the way. I send you to a radiology office
Uh-huh.
where a board certified radiologist reads them, uh, diagnoses and documents, and then sends me the report about what they think is wrong with your spine. Then, if they need a recommendation for an MRI,
Hmm.
which the MRI specifically will see your disc and see if it's degenerated, uh, herniated, or just bulged, that'll give us another good opinion on how we should proceed to treat you. Herniations, bulges, and degeneration are all treated differently. They're all treatable, but not always by me solely.
Okay, great. When somebody starts receiving chiropractic care, is there an expectation on when they're going to start to feel better?
Everybody is different. That's a common question. My general mode of work is anybody that comes into my office, and if I think I can help them, I tell them, and we lay out a treatment plan for them, and then we begin to treat. Generally speaking, I start people every other day,
Hmm.
and I treat you every other day. And people say, well, why do you do that? I do that because I can put the vertebrae in place.
Hmm.
And if it's got spasm around it, if it's inflamed, if it's swollen, it's going to squeak back out and it's going to come back out of place again. So
Hmm.
I have to do this on a repetitive basis until we get the inflammation to die down, the muscles to calm down. And when I put the vertebrae in place, it'll start to stay in place. And at that point, instead of seeing you 3 times a week, we start reducing the number of visits you have.
Okay.
The better you get, the less we see of you.
Oh, awesome. Okay. Can folks expect to receive any medication for their pain while they're working with you?
Um, Medication is not in chiropractic's um, practice act. If you need medication or other than anything over the counter, I would have to send you back to your family physician
Hmm.
and send him a brief report about what I'm doing, what I think is wrong, and he will examine you and then medicate you at his will.
Oh, okay. Awesome. Who's a good candidate for chiropractic, Dr. Bennett?
People that have, pardon me, we see a lot of neck pain, back pain, headaches, whiplash, that kind of thing. We also see a good amount of people that are just sick and tired of being sick and tired.
Hmm.
These are people that have been sick for years. And generally, it goes beyond just simple pinched nerves for these people. It oftentimes goes into lifestyle of, these are people that don't exercise,
Hmm.
they're grossly overweight, they eat badly, they drink badly, they smoke, they do everything that they can to drag the body down, and then all of a sudden they feel that they're sick and they just not are getting well.
Hmm.
So what we do is we try to coach them into a healthy lifestyle along with good eating and exercise habits, and we also give them treatment to make sure there are no pinched nerves that are creating their problems. So it's a whole ball of wax. We give them the manipulation, we give them the therapy, the rehab, and then we give them lifestyle coaching.
Awesome. Again, we're speaking with Dr. James Bennett of Northdale Chiropractic. Northdale, Northdale Chiropractic is there to help you with your Tampa chiropractor needs. They achieve success through the integration of traditional and modern day methods of treatment. And if you're in pain, you can give them a call right now at 813-252-2711. They're happy to schedule an appointment with Dr. Bennett so he can help you feel better and you don't have to live that way any longer. So, Dr. Bennett, do you treat all your patients the same way? Are they all adjusted the same?
Well, the general adjustment is done in the same general manner, but everybody is individual.
Mm-hmm.
Everyone has 24 individual vertebrae,
Mm-hmm.
and not everybody has the same ones that are out of place, that are stuck, that are pinched, that are subluxated.
Got it.
So we treat them basically the same way with manipulation. I also have an arthrostim adjusting instrument. There's a good amount of people out there that do not like the cracking and crunching of a manual adjustment.
Mm-hmm.
And I understand that. I've been going to a chiropractor personally since I was 7 years old, so I'm pretty used to it. But some people don't like it. So I have an arthrostim instrument that's a percussion instrument that will adjust the vertebrae painlessly
Mm-hmm.
without the cracking and the crunching and without side effects afterwards. Arthrostim instrument.
Awesome. Yeah, the arthrostem is wonderful. I know that's what you've used on me, especially because I've been antsy and very nervous in receiving treatment. That's been a gentle way for me to get the most benefit out of my chiropractic treatments with you.
I'm glad for
Yes.
that.
Can somebody adjust themselves?
They cannot adjust themselves. They can take their head and their neck and they can twist and turn and they can crack the bones.
Uh-huh.
But that's like cracking your knuckles. Nothing really happens.
Uh-huh.
You're just burping gas out of the joint. For the adjustment to be effective, you have to move the bone, not just stress it and crack it like a knuckle.
Got it. Okay. I hear often that newborns have a lot of benefit when they receive chiropractic treatment. Can you talk to us about newborns and babies and why chiropractic can be effective in treating them?
Newborns come out very traumatically generally, and not every newborn that comes out needs a chiropractic adjustment.
Hmm.
And people, I think, have the wrong view of how chiropractors treat children. Now, I have 3 daughters, and I
Hmm.
have treated every one of them since they were infants. And I use the tip of my little finger, and you can put it on their little spines and just press a little bit, and they wiggle around. And then, if the vertebrae is going to move, it will drop right into place where you want it.
Uh-huh.
You don't have to thrust on it, you don't have to make it crack. You just have to put a little bit of pressure on it.
Hmm.
So children respond very quickly. They have such good immune systems. They respond very quickly and very positively. And most kids that come into me are suffering from chronic uh, aches and pains. Generally, we get a lot of them that are sick, asthma, allergies, stomach problems, bowel problems. We see a lot of that.
Hmm.
And for some of those people, if they have a pinched nerve, the only thing that's going to get them better is a chiropractic adjustment. If it is not a pinched nerve, then I'm not going to treat it because I don't have the means to treat that. That's a medical referral.
I see. Okay, great. Well, let's go to the other end of the spectrum then. How about seniors and those who maybe have osteoporosis? Is chiropractic care safe for the senior population?
Chiropractic care is very safe with some admonitions. There are people that you do not want to actively manipulate,
Hmm.
and someone with severe osteoporosis is one of those people that you do not want to actively manipulate.
Hmm.
The whole body vibe and the arthrostem adjusting instrument are the things that we do for people with severe osteoporosis. We have a lady now that's coming in for severe osteoporosis, and she has been regular as clockwork with her rehab, and uh, her scores on her osteoporosis test have come up 50 points since she's been doing the whole body vibe, and she is absolutely thrilled. She's 50 years old, tremendous osteoporosis, and she thought she was never going to do anything but fall apart.
Mhm.
And now she's back to walking, halfway running, and swimming, and
Wow,
she's doing quite well.
that's fantastic. Great.
Yeah, and we're talking about seniors.
Uh-huh.
Seniors also have special sets of their own different ailments because they just get worn out. Joints wear out over time,
Sure.
and we can all look back and say, "Boy, I wish I was 39." But we use our body, we misuse our body. Some of us take really good care of our bodies, but the ones that don't are the ones that are going to pay for it in the end. The healthiest people that I see with the most longevity, with the best health,
Mhm.
are the ones that eat right and exercise regularly. Exercise, I think, is the key to living a long life.
Okay, terrific. Let's switch a little bit. And how about chiropractic after somebody's had some sort of surgical procedure?
After a surgical procedure, you have to leave them alone so that their surgery area can heal.
Mhm.
Because the one thing I don't want to do is I don't want to interfere with that recent surgery and hurt somebody. And then I've got a lot of people mad at me. I've got their family, I've got them, and I've got their surgeon who did the surgery, who probably did a really good job. So we don't touch people with surgery at least for 6 weeks after they've had surgery, and then we get their MD's okay that it's okay to treat them.
Got it. Okay. Well, that makes terrific sense. And again, is there a length of time that somebody can expect to be receiving care if they're, coming to you for pain?
I think the generally accepted timeline for most people, and this has been proven and again, is about a month.
Uh-huh.
And if I work on you every other day for 4 weeks,
Mhm.
and at the end of 4 weeks, you show no progress whatsoever, it's time to rethink what we're doing with you. It's time to rethink if you've really got something I can treat, and then think about other alternatives.
Mhm.
Some people do need to come longer because you have chronic problems and you've had them for years. It's going to obviously take longer, but most people with most ordinary conditions within a month should be up and running and doing well.
Okay, terrific. We've been talking about people who've been in pain, Dr. Bennett, but we just had the Olympics a couple months back, and I've noticed a lot of the athletes that are part of the Olympics, they don't have pain. They're in top physical condition, yet they get seen by a chiropractor in between their events. Why would they need to see a chiropractor?
Well, they are in terrific top notch shape and they want to stay that way.
Hmm.
And a lot of them have found that chiropractic increases their competitivity. What's the word?
Competitiveness?
Competitiveness. Yeah, I'm sorry.
That's okay.
Competitiveness.
Uh-huh.
Yes. It just gives them maybe a 10% edge over everybody else.
Hmm.
It keeps them healthy and working correctly.
Okay.
Yeah.
That makes a lot of
And you
sense.
you will notice on a lot of professional football teams, baseball teams, soccer,
Uh-huh.
they all have chiropractors as part of their team trainer system.
Hmm. Okay. Well, that's great. And, I know that, a lot of them don't travel without their designated chiropractor or the team chiropractor, if you will. So I've also heard it said that, when you're a healthy person and you go in and you continue to receive chiropractic care on an ongoing basis, that you're liable to be healthier in general. Because everything is positioned correctly. You don't really get sick or have a cold. Is that true?
Yes, it is. People don't realize it, and it's not been generally recognized by the public. But
Mm-hmm.
your nerve system controls the immune system.
Uh-huh.
And the immune system is another system in your body, just like the muscular system, the neurological system, the gastric system. It's another system. And if the nerves are pinched and all the organs that are responsible for your immunity,
Uh-huh.
which are mainly in the gut, are not going to function correctly. Therefore, your immunity is probably going to drop and make you more susceptible to illness. And so we have what we call maintenance care for people that have chronic pinched nerves, chronic degeneration, chronic subluxation. that we can make them feel better, but we can't fix them.
Hmm.
So we work them up till we get them as optimally healthy as we can, and then we see them every month or every couple of months on a maintenance basis, and it keeps them healthy, wealthy, and wise.
Awesome. We're speaking with Dr. James Bennett of Northdale Chiropractic. Northdale Chiropractic is conveniently located in the Northdale Plaza on the corner of Mapledale and Northdale Boulevard, across the street from the Northdale Park and Recreation Center. And their gorgeous office overlooks a beautiful garden atrium and a fountain. It's located at 3903 Northdale Boulevard in Tampa at 33624 is their zip. Again, if you'd like to schedule an appointment with Dr. Bennett, give their office a call. You can reach them at 813-252-2711, or you can go online and visit their website and learn more about chiropractic at www.northdalechiropractic.com. My name is Terry Bork. You're listening to Go Mind Your Business on All Your Business Radio, and we'll be right back after this message from our sponsor, Extreme Marketing Concepts. And we're back to Go Mind Your Business. My name is Terry Borg with Extreme Marketing Concepts, and today my very special guest is Dr. James Bennett of Northdale Chiropractic. Again, special thanks to our sponsors, Extreme Marketing Concepts, for putting your business in front of the hungry herd of buyers right away to increase your bottom line. You can reach them at 813-863-1452. Or visit them online at www.extrememarketingconcepts.com to learn how they can help you increase your business. Again, welcome back, Dr. Bennett.
Thank you very much. Glad to be here.
Yeah. I just want to switch it up for a few minutes and talk about how chiropractic can benefit folks who've been involved in an automobile accident. Sometimes folks have a little tap and they don't think that they need to go see a doctor. What do you find from that?
I find that anybody that gets hit and they're not aware they're going to be hit is going to have damage.
Uh-huh.
If you're sitting in your car and somebody behind you hits you in your rear going 2 miles an hour in their car, your car's not going to have a lot of damage. But you would not stand by yourself in front of that car and let him hit you at 2 miles an hour. It would do a tremendous amount of damage. Well, the force that goes into your bumper, even though the bumper may retract some, the force continues on through the car until it gets to your body.
Uh-huh.
And then all of a sudden, you're going to get that whip back and forward. And that's what they call the whiplash. And when you do that, you tear little muscles, little muscle fibers, little nerve fibers, little blood vessels, and it gives you problems almost certainly. And you may not know it today, and you may not know it next week, but oftentimes several weeks or several months down the road from the injury, you come up with all kinds of symptoms, and you're wondering, well, where did this come from? It can't have been that car accident. It was just a little bump. Well, science has shown that little bump can do a great deal of damage, and that's what we would like to do, is get you before you end up having a lot of symptoms down the line.
Mm-hmm.
And then it'll take longer to get you feeling better.
Okay. Are there, when you have a whiplash, so to speak, are there typical things that are associated with a whiplash that folks can look for if they're involved in an accident?
Well, the first thing you want to think about is, are you disoriented?
Mm-hmm.
If you're disoriented and dizzy at the scene, you might go to the emergency room and have somebody check you out to make sure you don't have a pretty good whiplash or
Mm-hmm.
concussion. I'm sorry. Starting January 1st, the law has changed for PIP, pardon me, auto accidents,
Right.
and they have made it. And I don't really understand all this, but anybody that's in any kind of auto accident, no matter how minor, has to go to the emergency room or a medical physician first to be certified in emergency medical condition.
Uh-huh.
If they certify you as an emergency medical condition, which has not been defined, by the way, then you can get your $10,000 worth of PIP coverage that you pay for every day. You pay for $10,000 of medical coverage when you're in an auto accident.
Mhm.
However, if you don't comply to the letter of the new law and do something within 3 to 14 days, you're only going to get $2,500 worth of benefit. So
Got
you're
it.
going to pay for 10,000. If you don't comply with their new rule, you're only going to get $2,500 worth of care.
I get it. Wow. So that's a big difference. And, if you're not going to know that you're going to have some sort of ramifications from a tap on your bumper, you're better off just going and getting checked out and then working with a chiropractor to make sure that you're going to be pain free.
Yes, you should be checked out by somebody. You should go be checked out by your family doctor or an emergency room, or you
Uh-huh.
can come directly to the chiropractor.
Oh, okay. Awesome. Um, well, thank you for touching on the automobile accidents. I know that will help many people, and a lot of, especially when you think, oh, there's no damage, I'm not hurt. You never know.
Yeah, well, most of your chiropractors in the area that we're in are ethical, nice, well-practicing chiropractors and medical doctors.
Uh-huh.
And this law was made specifically to combat the amount of fraud that goes on in the big cities like Miami, Orlando, Jacksonville, Tampa.
Uh-huh.
There's a lot of fraud, but the law does not do a thing to combat fraud directly at all.
Right.
It was meant to combat fraud, but it does not.
I see. Okay. Well, let's switch it up a little bit. Do lots of people go see a chiropractor in general?
Oh, sure. Yeah, every year chiropractors just give millions and millions of adjustments to millions of people. It's just a very common thing.
Got it. Okay. Are chiropractors seen as real doctors in the medical field?
Um, Depends on who you talk to. Chiropractors have these days have got 8 years of education,
Hmm.
and we earn a doctor of chiropractic degree, and we're a doctor just as much as a dentist, an optometrist, or anyone else is. Now, our basic sciences are the same thing as medical doctors take, as dentists take, as any other doctor takes. Same basic sciences we all take.
Hmm.
The only thing different about me and a medical doctor is our mode of treatment. Medical doctors do medicine, medical doctors do surgery. Chiropractors do rehabilitation, and they do chiropractic manipulation. So we can work together, but I can't do the medical doctor's job, and he can't do mine.
Got it. Okay. Um, do chiropractors only treat back pain, Dr. Bennett?
Oh, not at all. We treat pretty much anything that comes in if they have a pinched nerve, and that's why we go through the examination and consultation process to figure out if you do have a pinched nerve. And when you do have a pinched nerve, if we don't unpinch it, you're not going to get well.
Hmm.
You can take medication, you can have surgery, but if you only treat the symptoms, you're going to continue to be sick, and it will ultimately rear its ugly head again for you. So rather than cover it up, we want to get to the cause.
Got it. Okay. Is an adjustment going to hurt?
Not usually. Some people that come in that are in pain already, we do two or three things. We try to get them calmed down with some physiotherapy. We have several licensed massage therapists that work with us.
Hmm.
And we also have the advantage of picking up the phone and calling your family doctor and saying, hey, I have this fellow here who's in a great amount of pain.
Hmm.
He's got swelling in his lower back. He's got spasms. I can't treat him. Would you check him, medicate him, get him calmed down, and then maybe next week or 10 days from now, I can start to treat him and get rid of the cause of why he's having such problems. And that's where we co-manage these patients.
Got it. Okay. Well, that's great that you're able to work with somebody's family physician so you can manage their care together and ease the discomfort of somebody. That's terrific. Are spinal adjustments at all dangerous to the body?
Not usually. They can be.
Uh-huh.
Some people have hidden fractures. Some people have hidden herniations. Some people are just very, very brittle, as in
Hmm.
osteoporosis.
Right?
And those are things that you've got to be very careful for. Pardon me. And that's where the doctoring comes in, is when to know not to treat somebody.
Okay,
I have to know when to refer someone out so that they can get the most optimal care for their conditions.
I got it. Okay. A little bit ago, you gave an example of somebody cracking their knuckles. Is it true that if you crack your knuckles, you can get arthritis?
Probably not. There's been thousands of studies on that, and I think the most common finding is it does not create arthritis.
Mm-hmm. Okay. I need you to adjust your mic a little bit so it's closer to your mouth. Okay.
Okay.
Uh-huh. Do chiropractors crack your bones, Dr. Bennett?
Well, we don't like that terminology.
Uh-huh.
We adjust your spine, and sometimes when you get a manual manipulation, the vertebrae will crack just like your knuckles do.
Okay.
And again, like I said before, it's mainly gas in the joint, hydrogen, oxygen, nitrogen. And when you burp that joint, it cracks.
Mm-hmm. Okay. Is chiropractic care expensive?
It's like any kind of medicine or any kind of healing arts. It depends on the individual doctor, the place you go to, and what your problem is and how long it will take to get it. Generally, I would say it's within the reach of most everybody, particularly if you have some kind of Medicare or health insurance.
Mm-hmm.
You're pretty well home free there. But again, we don't refuse treatment to anybody, regardless of condition or financial ability to pay.
Mm-hmm.
If you need the care, we'll work out a plan for you that you can afford, and we will give you the care.
Okay, I got it. Let's talk a little bit about some new terminology that I've heard come across called text neck. What can you tell me about that?
Text neck, interesting, isn't it?
Uh-huh.
We just saw a fellow down the hall with text neck, classic case. Um, you see these kids going around now, and not only kids but adults too,
Right.
with the advent of computers and cell phones. Everybody has got the cell phone in their hand, their head is bent down, and they're playing with their cell phone.
Uh-huh.
And I don't recall the exact studies, but how many thousands of texts and things that these people send in a month
Mm-hmm.
is astronomical. So they are spending a lot of time with their head bent forward and down.
Mm-hmm.
And what that does, it creates an abnormal condition or position for your neck.
Mm-hmm.
And it's got to be so common now, they've got a new term for it, and it's called text neck, and it's a real syndrome.
Right.
You see a lot of people showing up in the emergency room and doctors' offices that have headaches, neck aches, dizziness, shoulder pain, numbness down their arms and hands. And that's from their posture doing texting and computer all day long.
Okay. Is there other than, getting treatment from chiropractic or from their physician, how can somebody try to avoid receiving text neck?
Well, you can avoid text neck in your home with your computer. We're looking at this computer. This computer is exactly the right height. It's right in line with my eyesight, so I don't have to bend up or down to see it.
Mm-hmm.
But if you have to go from anything but a neutral position to see your phone, for example, you have to do this. That's not good. You have to correct it.
Mm-hmm.
And I don't know how to tell you to hold that thing up here and text it. It doesn't look cool, but it's so much more ergonomically correct.
Okay, so having your device at eye level will help avoid some of the text neck syndrome that folks are getting.
Yes, that will help. And another item that I find particularly helpful for me, I'm not a real fan of texting. My phone, fortunately, has a voice recognition thing that I can just push the button,
Mm-hmm.
talk, and it'll make up my text, and then I can send it.
Okay.
So I don't have to spend the time sitting there, type, 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 type.
Right. Okay. Got it. And then as far as when you're working at your computer, does your posture have anything to do with text neck?
Yes. Yes, you've got to have good posture. You just basically have to sit in a nice neutral position in a nice ergonomically designed chair,
Mm-hmm.
one that feels comfy when you sit down in it.
Mm-hmm.
And again, like I said, if you have to lift your head up or your head down to see your computer screen or your cell phone, then you're not sitting or not doing it correctly. You need to adjust the computer or the text or the cell phone.
Okay. I got that. Okay. I'd like to talk to you about your onboarding process with a lot of your patients. I know that you do a lot of things in the community and a lot of things with your patients to get them started to good health. Um, Tell us about your Dine with the Docs program and how that works and what makes a good candidate for that.
Oh, we have a lot of fun with the Dime with the Doc. I find that people have just a truckload of questions about chiropractic that they never get answered because either they go to a chiropractor who just doesn't have time or is not interested to explain to them. And to be sure, we get busy in our office, and I don't take the time to give that kind of conversation to everybody. So, what I do is I take my new patients and anybody else that's interested, a husband,
Mhm.
a wife, a neighbor, or another relative that's interested in getting better health and through chiropractic. We have a get together, and we did our last one at Mimi's restaurant, which was a very nice place.
Right.
And we had, I think, 21 people there,
Right.
and we just bought them all dinner. And I went through a new patient orientation of how I do what I do, and then I ask for questions. And I tell people, ask me anything you want. You're not going to hurt my feelings.
Mhm.
All the things that people can say to me about being a chiropractor have already been said. So I will answer any questions they have about chiropractic from A to Z. And it's just a fine educational experience. And I find that people, when they hear it, see it on a view box, which I take an X-ray as a sample,
Uh-huh.
and I show them what the spine looks like,
Right.
um, they learn really well rather than just having to read a pamphlet or something that says, "Oh, the chiropractor can do this." When I sit them down and I show them
Mhm.
how we do it, that really gets through. And so we invite anybody that would like to come. We will invite you. You're our guest at no charge, and Mimi's puts out a very nice dinner.
Terrific. Again, we're speaking with Dr. James Bennett of Northdale Chiropractic today on Go Mind Your Business. Dr. Bennett can be reached at 813-252-2711, or you can visit his website at northdalechiropractic.com to learn more about Dine with the Doc, and to make your reservation. Dr. Bennett, I know that you're involved in a lot of other things within the community as well, and you speak all over the town. What are some organizations that you do like to speak to, and what are some of the topics that you like to talk about?
Generally, when I'm asked to speak, it's about chiropractic and health, and I'll speak about anything with health and chiropractic
Mm-hmm.
and spinal conditions. I'm a member of the North Tampa Chamber of Commerce. I get a chance to speak there from time to time.
Mm-hmm.
I'm a member of BNI in Heritage Harbor, Platinum Chapter BNI.
Right.
I speak there with our members,
Mm-hmm.
and from our members there, I get referrals to speak to other places.
Mm-hmm.
I'm in several other networking meetings that I go to, uh, like one I have today after here called New Way Networking.
Mm-hmm.
And it's just a group of interested business owners who get together and we share information, we share contacts,
Right.
and we refer to amongst ourselves for business.
Okay. Awesome. Um, your office again is located at 3903 Northdale Boulevard in Tampa, 33624, and you're just down the street from the Northdale YMCA.
Half a block east of the YMCA.
Half a block east of the YMCA. Okay. Now talk more into the microphone so I can hear you
Oh,
better.
okay.
Okay, great. So is chiropractic, once you start with chiropractic, are you going to spend your whole life in chiropractic?
Well, you should have some portion of your life that's involved in chiropractic just
Okay.
because you want to keep your general health at optimal levels.
Sure.
I feel personally that if somebody doesn't get a chiropractic adjustment at least 4 to 5 times a year, I think they're going backwards than going forward.
Mhm.
They're not maintaining their health optimally. So I feel very strongly about the fact that chiropractic and nerve health is extremely important to your general health.
Awesome. Okay. Is there any other things that you'd like to share with our listeners that we haven't covered today that you think can help them in their chiropractic treatment?
I would say that if you have health issues, number one, you can come to my office and I will give you a consultation at no charge.
Mhm.
Just mentioned extreme marketing concepts in this show. And I would advise you, after we've gone through a consultation and examination, on what you can do to help yourself: exercise, diet, eating the right foods, stopping habits that you've had that you think you can't stop, and just generally looking after your health in a general manner.
Mhm.
And part of that, exercising, eating right, and getting rid of bad habits, you throw in there, intermittent chiropractic care throughout the year to keep my spine pinched nerve free should be an integral part of your health plan.
Got it. Okay. Again, we've been speaking with Dr. James Bennett of Northdale Chiropractic. You can reach them at 813-252-2711, or of course visiting their website where they have tons of great information at www.northdalechiropractic.com. There is some photographs of their office so that you can see what they're going to do, or some of the equipment that Dr. Bennett is going to use right on their website. It's also got a picture of the whole body vibrator, which again is an amazing tool that will help your body feel terrific, increase your endorphins, and make you feel like you've been exercising for an hour with just 5 or 10 minutes on the machine. And your body gets great performance from that.
Yes, they do say that if you do 10 minutes of work, and that doesn't mean just standing there, but we have a set of exercises you do while you're on there. If you do those exercises for 10 minutes, they say it's equivalent to having an hour's worth of aerobic workout.
Right. And I know that Madonna uses it and she incorporates it with her regular workouts that she does in the gym on her off days. So, stars are using it, regular folks are using it, and they're seeing tremendous benefit. And NASA's using it as well.
And the Russians.
Oh, and the Russians. Can't forget the Russians.
I also had the YMCA come into the office about 3 or 4 weeks ago that they heard that I had a whole body vibe, and they're thinking about buying some and putting them in the YMCA. That's how impressed they are.
Oh, wow.
So it's really an invaluable rehabilitation tool.
Okay, great. Well, you saw it here on Northdale Chiropractic first on Go Mind Your Business. So awesome. I recommend that to everybody. I know it makes me happy, and when I get off of it, I feel like a whole new person. Well, Dr. Bennett, I want to thank you so much for joining us today on Go Mind Your Business. It was my pleasure to have you as our special guest.
It was my pleasure to be here.
Yes. And again, our listeners can call 813-252-2711 to make their appointment with Dr. Bennett, and visiting their website at www.northdalechiropractic.com. And one more time, their address is 3903 Northdale Boulevard in Tampa, Florida, 33624. I want to thank our sponsors, Extreme Marketing Concepts, for hosting our program today. Extreme Marketing Concepts can increase your marketing online. All you need to do is give them a call at 813-863-1452 or visit their website at www.extrememarketingconcepts.com. My name is Terry Bork, and you've been listening to Go Mind Your Business on All Your Business Radio, and we will see you next week. I hope you guys have a fantastic Thanksgiving holiday, and thank you so much for joining us today. Take care, everybody. Bye-bye.
Thank you for listening to Go Mind Your Business with Terry Bork, presented by Extreme Marketing Concepts. If you want to drive more traffic, dominate the market, and crush your competition, find out how by visiting our website, www.extrememarketingconcepts.com. And join Terry next time for another episode of Go Mind Your Business.